All right. Your hand will be tired, Kayla. All right. Okay, here you go. I want everybody to read the question, every question, answer options, and put your answer in the chat. Okay, there's still a couple of students who haven't responded. So as I said earlier, guys, please make sure you follow what I'm telling you. Okay, this is not for anybody, it is for you. I can tell you the right path, but you have to walk on it. All right, so everybody answered it correctly. A is the correct choice. Establishing rapport with the patient is crucial during the assessment phase of nursing the ADPI process. Building trust and therapeutic relationship with the patient, that's what lays the foundation for effective communication and collaboration throughout the entire nursing process. So very, very, very important, establishing rapport with the patient. Okay, next question. All right, so except one or two, everybody, okay, there you go. So everybody answered correctly. B is the correct choice because if you look at the keyword, it says evaluation phase of the ADPI. So evaluation is where you evaluate. You look into like, okay, you assess whatever you did, is it working or not? So assessing the effectiveness of nursing intervention, B, that is the correct choice here. Good job, proud of you. There you go. Okay, nice. Once again, yes, B is the correct choice here. The most appropriate action to evaluate if the outcome criteria has been met is to directly observe the patient perform that. Okay, you show them first and ask them to give you a return demonstration. Okay. All right, yes. 30 if you answered correctly. C is the correct choice here. The tricky word here is first. Keyword first. First, what to do. First is to acknowledge, right? Respect the patient's right to refuse the medication and then find out why. And after that, you should document it. Excuse me. Okay, next question. Okay, great job. Once again, yes, he's the correct choice, liquid. Anything which is already in a dissolved form that can be absorbed quickly. So capsule and tablet. Now capsule has a shell on it, even though it has tiny granules inside, which will dissolve quickly as compared to the tablet, but it still needs to be dissolved after the shell is open up or dissolve. Tablet itself, tablet has binding agent which holds it, right? That's why it's in the tablet form, because as a binder, a binding agent, like a glue. It needs to break down and then get dissolved. Liquids are already, it's already dissolved. Solid is dissolved in the liquid. All right. Okay, once again, C is the correct choice is powder, 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 powder. All right, next question. Excuse me. Okay, well done, guys. Yes, A is the correct choice here because IV drugs, they bypass the liver and GI tract. That's the first pass effect. And that's where metabolism happens and a major part of the drug gets excreted out of the system without producing any therapeutic effect. And when you infuse an IV drug, It's directly going into the system. 100% of the drug is available because it doesn't have to go through the liver's first pass effect. Okay. Okay, so this might be a little tricky, but make sure you know what is what. Pharmacodynamic. Remember pharmacokinetic and dynamic. There were those terms which usually gets mixed up. So kinetic is the movement of the drug in the body, right? So you need to narrow down. So pharmacodynamic, it focuses on how the drugs interact with specific receptors, enzymes, other molecules in the body to produce its therapeutic effect. So it includes the mechanism of actions and stuff in here. Okay, so we're talking about B here. Your kinetic is the ADME, absorption, distribution, metabolism, and excretion. Okay, A is for kinetic. Okay, let's look into that as well, if you remember. Okay, good job. B is the correct one here. Okay. Okay, next question. Okay. So everybody answered correctly. It's liver. Liver is the one responsible for metabolism. Let's look into another one. Excuse me. Okay. So for this as well, B is the correct choice. Kidney is responsible for excretion. Okay, let's pick up a piece of paper and a pen to do a calculation. Fun part. Excuse me. Okay. Okay, good. Many answers, and looks like everybody answered correctly. It is 42. 42. Good job. Good job. Good job. Good job. Okay, this is how we got it. So you need a volume over time multiplied by the drop factor. Know these formulas so that you don't get confused by the amount of information, and you just kind of extract out the information you need. So you need the volume, time, and the drop factor. Okay, another one. Okay, looks like the answer I'm getting is 38. Let's see. Okay, provider 150 ml per hour. Okay, the drop factor is 15 drop per ml. So now the volume is what? 150 ml, right? And what is the time here? What's the time? 1 hour?
1 hour, 60
Right?
minutes.
Yeah, 1 hour.
So now they're asking you how many drops in a minute. Do they match what they are giving you and what you need? They don't, right? Hours and minutes are different. Do you need a conversion here? Did you
Yes.
guys do that?
Yes.
Yes? Okay. Yeah, I see that, Danielle. How about everyone else, guys? Did you do the conversion for the time? Okay. All right. This is how to do because it's given an hour and we have to give a product in minutes. So you need to convert hour into minutes. So it is 1 hour. 1 hour is equal to 60 minutes. So volume is 150 ml. Divide by the time, which was 1 hour. You need to convert into 60 minutes. 60 minutes multiplied by the drop factor, which is 15. That's what the answer should be. Is everybody clear about that now? What mistake we made? Yes? No?
Why did it raise up to 50?
Oh, you know what? No. Don't worry about that. 38, I'm sorry, 38, the correct one. They're doing it differently. Sorry, I forgot
Okay.
to black out that one. It's 38. Okay. All right. So here's another one. Hey, good job. Good job. Good job. Good job. 33. Good job. Okay, next question. Okay. Looks like everybody answered correctly. And the correct answer is B, to reduce the risk of contracting the disease. All right. Okay, excuse me. Yes, C is the correct choice here. C is the correct choice. Very well done. Okay. Okay. Well, looks like everyone is on the right one. B is the correct choice, guys. B is the correct choice. Can place the new patch on the same spot? No, not on the same. You always rotate. Rotate the side of application. Okay. Okay. All right, most of you got it right. It is D. Okay, evidence-based resources, your drug databases, pregnancy registries, also, your, for example, if you have a pocket drug book, so any drug reference, reputable drug reference, that should be looked into, referred to, not just simple Google it. It has to be reputable. Okay. So again, yes, D is the correct choice, guys. So acetaminophen, Tylenol, the biggest concern should be liver damage. So we should be monitoring liver function test. Okay. Those are your ALT, ASTs. Okay, come on, everyone, try to answer. I'm still missing about 8 students. All right, C is the correct choice here. Everything is down here. Decreased sense of touch, decreased cognitive function, decreased short-term memory. It's an old machine, everything going down. Okay. Okay, B is the correct choice here. Informed consent. That's part of your responsibility. If you're involved in any studies where a drug will be given to anybody, they should be aware of everything, what is going to happen, what they will be given, what therapeutic effects or adverse effects are expected. And then make sure they know it, they understand it. If they don't, call the doctor, let them explain it. And once they confirm that, yes, I understand everything and I agree to that, that's when you ask them to sign the consent form. Okay. And if at any point in the beginning or at any point of the study, if they say, hey, I don't want to be a part of it anymore, well, you first say, yes, you have the right to participating in this study. First acknowledge and then ask them the reason and then document it. Okay. Okay, well done. B is the correct choice here. +1, you won't see that because that is not in practice. Your scope of practice, you won't see that. There's in certain studies only. Class 2, 3, 4, you will see, but the highest potential of abuse is with Schedule 2 drugs out of them. Excuse me. Okay. So C is the correct choice here. Autonomy. Respecting a patient's right to make their own decisions regarding their healthcare, as long as they're competent and fully informed. So in this particular scenario, the patient has made an informed decision to refuse chemotherapy, which the nurse must honor, even if it conflicts with their own beliefs or the medical team's recommendation. Okay. All right, next question. All right, good job, guys. B is the correct choice because beneficence is what? Doing good, right? Best interest of the patient and promoting their well-being. And when you explain the potential risk of early ambulation and then encouraging rest, the nurse is prioritizing the patient's safety and recovery. This approach will help prevent any harm and promotes a positive outcome for the patient, aligning with the ethical principle of beneficence. Okay, good job. Okay, nice. C is the correct one here. Polypharmacy, patient taking many drugs because of maybe many conditions they have. And both things can happen. Maybe they're taking more than needed, or maybe they're taking or missing what they should be taking. Inappropriate use of medication. Excuse me. Okay, B is the correct choice here. When you're working, for example, here in MedSearch unit, resources are limited, need to assign rooms based on like how you prioritize. Several patients requires high-level care, but the only few available with the necessary monitoring equipment. Well, action by the nurse best reflects the ethical principle of justice, that you treat equal. Um, so assigning the rooms to the patient with the greatest needs for close monitoring. You're just thinking who needs more monitoring than others, but you're treating equally, you're evaluating, and then you're prioritizing. Fair and equitable treatment to all patients. And in healthcare, another associated thing is that you allocate the resources based on clinical need rather than the personal characteristics, socioeconomic status, or any other biases. Okay, next question. Okay, yes, great job. Well, B is the correct choice. Is the correct choice. The principle of non-maleficence means do not harm, right? And when you choose this option B, the nurse takes steps to minimize potential harm by educating the patient on the risk associated with abruptly stopping the medication. Okay. Okay, wonderful. Yes, A is the correct choice. Because the nurse fails to meet the standard of care required, resulting in a potential harm to the patient. So the nurse was responsible for monitoring, documenting vital signs every hour. Every hour, it didn't happen. Okay, good job. Let's do another calculation, guys.
You're muted, Professor.
Professor, we can't hear you.
Oh, I'm sorry, I forgot. Okay, so volume is 75 ml. Time was 1 hour. We converted into minutes because that's what the output is needed. So 60 minutes multiplied by the drop factor, which is 20. And that gives you 1500 divided by 60 equal to 25 drops per minute. Okay. Do you guys want to take a break? Yeah. Okay, let's take a 15-minute break and then we'll continue.